Hi everyone and welcome back to the channel. Today we're going to talk about lower back pain. I'm going to try help you understand that pain, maybe figure out the source of the pain and give you some exercises that will help. For anyone that's come over from my Instagram channel, thank you for joining. I hope you learned something new. Let's get started. Okay, so now to try help you understand your lower back pain. There are primarily two types of lower back pain. One is acute pain and the second is chronic. Now acute pain occurs when you go to pick something up, you come back up and your pain is right there in the lower back, or you've gone to twist and pick something up from the side and again you're just getting a pull on the side of your back. This is acute pain, it has happened to you there and then. In this instance, you are looking to do some exercises and stretches to treat the site of the pain. In a chronic lower back pain, this is pain that you have had for quite some time. 9 times out of 10 it is not the fault of your lower back. Now the phrase gets thrown around a lot that you have a weak lower back. This is not the case. Generally speaking, there is something else in the body not doing its job correctly. Usually it is the joint above and below the lower back. This would be your T-spine, your hip and your pelvis. If these joints are not doing the job they should be, your lower back is going to kick in. It's going to give you the movement you need, even though it doesn't want to. This is going to result in the lower back getting fatigued, chronically sore, and causing you pain in your lower back. So over the next couple of clips, I'm going to show you a couple of things that you can do to check these areas. Check your T-spine, check your pelvis, and check your hip. Check if they're all moving properly. If they're not and you've got lower back pain, you are not looking to fix your lower back as such. You are looking to get to the source of that pain. So for example, if my hip joint is not rotating in less than 25 degrees, I know that that hip is not moving properly. So then when I will say, we'll just use my golf swing for example, if I go into my backswing and my hip will not rotate the way it should, my lower back is going to have to pick up the slack. It's going to have to do some of the rotation it doesn't want to. This will lead to getting chronically fatigued and resulting in pain. Okay, so now we'll move into the assessment part of the video where I try to help you find the source of your pain. The first thing we are going to look at is our T-spine or our mid-spine. Okay, so we are looking to see if this area of the spine rotates adequately. So what we're going to do is pop into a half kneeling stance. Our hip is at 90. We're going to grab a ball, a yoga block, a foam roller or something just to pop in between your knee and the wall just to fix your hip. Hands are going to come across the chest and we're going to rotate over the hip. What we're looking here for is a minimum of 45 degrees. So this is roughly 45 degrees. Hopefully you can move a little bit more, but as I said, 45 is a pass. If you are someone that rotates to here, maybe to 20 degrees of rotation, you've got a bit of tension on the mid-spine and the lower back, then you know this is a problem area for you and it is very likely that it's causing your chronic lower back pain. Now we are going to move on to assessing internal rotation and the hip joint. Again, another important joint in rotation, and it is often a cause of lower back pain. If your hip isn't rotating properly, your lower back is going to pick up the slack and cause pain. So this is how we're going to test it. Just sitting on an ordinary chair. Ideally we want the knees just slightly above the hips. We're going to pop a pin in between our knees. Sitting up nice and tall, we're just going to bring one ankle away from the other, one ankle fixed onto the ground, the other ankle moving out. Okay, what we're trying to achieve here is 25 degrees of internal rotation. So straight down is 0 degrees, moving your ankle out should be a minimum of 25. You're going to need some help maybe with someone at home just to eyeball and guess this one for you. If you're under the 25 degrees of rotation, you know it's a problem area for you. You're going to have to do some of the exercises towards the end of the video to help you fix it, and it should definitely help your lower back pain. And the last joint then we are going to look at is the pelvis. So the pelvis has a lot to do with your posture all up along your spine. Okay, generally people, we take a look at someone, we say they have a rounded posture, they have a rounded mid-spine, being in everyday life or in your golf swing. For this example here, I'm just going to get into a golf posture that looks maybe like that. I have a rounded mid-spine and upper spine. Okay, but what I'm going to do here is do a posterior tilt with my pelvis. So my pelvis, I'm going to pull it backwards. That's going to flatten my lower back. And now my spine looks very straight. Even though I've done nothing to this area, all I've done is anterior and posterior tilted my pelvis. And you can see the difference it makes. So to test for this, that's all we really got to do. We got to just get into a slightly hinged position, grip the golf club, and see if you're in an anterior tilt where your pelvis is all the way forward, or are we in a posterior tilt which is all the way back. Okay, we're looking to find somewhere neutral. Whether you're a golfer or not, you can still do that test, see what kind of posture you adopt, and we'll go from there. Now, I understand from being in the clinic with patients all the time that this anterior posterior tilting movement isn't the easiest. So in the exercises, I do that exercise lying flat on the ground. It's a little bit easier. Regardless if you can do that exercise standing up or not, or if you think you have a good pelvic posture in that stance, I would strongly suggest doing the pelvic exercises anyway. They're good to strengthen your abdominal floor, working those transabs, and they will help you down the line. Now, just to bring all of those points into context, I understand there was a lot there, but generally speaking, we do not have adequate rotation in our T-spine. Our hip joints aren't the best to rotate in, and most of us adopt anterior tilt in our pelvis. Okay, so just to show you what that looks like a little bit, especially in a golf swing, if I come in here with an anterior tilted pelvis, I've got bad rotation in my right hip, and I've got poor rotation in my T-spine. When I go to rotate, I'm going to get stuck here. This isn't want to go much further. There's two options from here. I overuse my shoulder joint, I overuse my lower back, and the common fault in the swing is going to be the hip moving out and kicking out. That's going to give you a little bit of extra rotation. It's a movement you don't want. The pros hate it. So get cracking on the next couple of exercises. Hopefully they'll help reduce your lower back pain and even help your technique. Okay, so that's kind of all the sources of the pain. Hopefully you can self-diagnose and maybe get to the root of your lower back pain. The first thing we are going to do is we are going to go into the T-spine exercises, so focusing on your mid-spine area. These exercises will help you rotate a little bit better, maybe get a little bit of extension through the spine. Take a little look at them, pause the video, give them a little try at home, and see if they're for you. Some of them are quite easy, they can be a little tough. The one a bit of advice I would give you is to keep pushing into that mobility block and keep trying to improve your range with every rep. The second set of exercises now is going to be improving internal rotation of the hip joint. Everyone should do this. A lot of us are sitting down all day, our hips get a little bit tight. Having internal rotation in your hip is very important in your golf swing and for everyday life. So give these a go. Again, work through the videos. Let me know how you get on. Good, I hope they went well. The last set of exercises now are working on your pelvic posture and pelvic stability. These are quite tough. What we're trying to do here is try to reduce the amount of shaking. You want a smooth movement through full range, something that I'm working on myself. Again, work through these videos, pause them as you go, do about 10 reps of each. You should feel your core working on all of these. Take your time with them and work through them as best you can. that's it for today. I hope this video helped you understand your lower back pain a little bit better. Maybe you've even developed the tools to find the source of your pain. Maybe you've done it there already. You have some exercises now to practice over the next couple of weeks. Try to get rid of that chronic lower back pain, and we'll get back into course pain free. So lastly, just on the topic of lower back pain, in this video I'm just trying to show you how to do a small little bit of a self-assessment. Try find the source of what is causing your chronic lower back pain, and it'll just give you the tools going forward to help reduce that happening again. There are many types of lower back pain, some serious and some not so serious. Once this lockdown is over, if you are getting persistent lower back pain, I would strongly advise getting this assessed properly. Okay, this is handy for now. It is handy to do now and again if your pain isn't too bad, but if you're suffering from bad back pain, go get it assessed, get it sorted. Refer back to this video as well after you've that done. It will help you going forward and help you reduce your lower back pain. Thank you all for watching. If you have any questions, please just let me know. I'll be more than happy to help out, and we'll talk to you in the next video.